Essentials of Pharmacology for Health Profession, 9th editions. We are now looking at Chapter 20, Psychotropic Medications, Alcohol, Drug Abuse, and Withdrawal Treatment. Our chapter objectives for Chapter 20 is, the first one is categorize the most commonly used psychotropic medications according to the following classification. Your CNS stimulants for promoting wakefulness and treating your ADHD, antidepressants, anti-manic agents for bipolar disorders,
anxiolytics,
and antipsychotic medications and tranquilizers. Your second one is list the purposes, actions, side effects, interactions, and precautions and contraindications for psychotropic medications in common use. Third one is explain the treatment of acute and chronic alcoholism. The fourth one is describe the effects of commonly used illegal drugs. And the fifth one is list the responsibilities of a healthcare professional in combating drug abuse. Psychotropic medication classifications. Psychotropic refers to any substances that act on the mind. Psychotropic medications exert a therapeutic effect on a person's mental processes, emotions, or behaviors. The psychotropic medications can be classified according to the purpose of the administration. Your first one is CNS stimulants, which promote wakefulness. Your ADHD agents that treat the ADHD. Your anti-manic agents, which treat the bipolar disorder.
anxiolytics,
Agents which treat anxiety. And your last one on the list is antipsychotic agents, which help relieve the symptoms of psychosis. Alright, so we're going to take a look at some of our medications for each of the following classifications, for each of the classifications that we just discussed. So for our CNS stimulants, we have caffeine, amphetamine, or
methylphenidate,
okay. And then for our ADHD agents, we have
atomoxetine,
alright, for our antidepressants, we have amitriptyline,
phenelzine,
fluoxetine,
escitalopram.
As we continue with our classifications and our medications, our first one is anemetic, which is lithium and
carbamazepine.
Our next agent is the
anxiolytic,
which has clonazepam, diazepam, and buspirone. Our next agent is our antipsychotic, which is
chlorpromazine,
in a haloperidol. So what you're looking at on your screen is a summary of the psychotropic drugs. It gives you like the categories. It just gives you a visual view of it. You can also see the table. It's 20-4 in between the pages of 421 and 422 in your ebook. Take a minute and look at it and review it to help get better familiarized with those. Alright, knowledge check activity. Which condition does anti-manic drugs treat? Look at your choices and write down your answer. We'll check it at the end of the video. Okay, so now we're going to discuss a little bit more deeper in depth the central nervous system stimulants. So your CNS stimulants are given for the purpose of promoting the CNS functioning. Your common drugs within this category includes caffeine, amphetamine, and
methylphenidate,
preparations, and wakefulness promoting agents. The following chart illustrates the action, use, side effects, contraindications, and interactions of commonly used CNS stimulants. Now, I'm not going to read this to you. You have it in a box. Review it and get familiar with it. Very familiar with it. And we continue with the CNS stimulants. Alright, so this is our last CNS stimulants that is in our table for us. Our next thing is what we should do is make sure that we read the patient education on page 402 and know how we should be how we should educate our patients and when to do it. Okay. Now our next one is our attention deficit hyperactivity disorder, which is your ADHD. Our selective norepinephrine reuptake inhibitors, which is shortened for SNRIs, which we know that they are used to treat ADHD. And one agent of that is Jartira. Look at your use, your side effects, caution or contraindications, and your interactions. Make sure you get very familiar with those. Alright, so as we continue, we are going to be looking at antidepressant agents. The exact cause of depression is unknown, but it may result from a chemical imbalance in your brain. In depression, there may be a shortage of the neurotransmitters like dopamine, serotonin, or norepinephrine. Antidepressant medications, sometimes called like your mood elevators, are used primarily to treat patients with various types of depression. There are 5 categories used to treat depression, which include tricyclic antidepressants, MAOIs, selective serotonin reuptake inhibitors, your SSRIs, SNRIs, and your heterocyclic antidepressants. The FDA has directed manufacturers of all antidepressants to include a black box warning that antidepressants increase the risk of suicidal thinking and behavior, particularly during the first few months of its therapy. In short-term studies in children and adolescents with manic depressive disorder and other psychiatric disorders, this is a category of antidepressant. There's a medication, the tricyclics. The use, the side effects, cautions, or contraindications, and the interactions. Make sure you take time to review these. Alright, so what does the learning hint mention? You can see that in your ebook on page 406. We're going to get into antidepressant agents. The mechanism of antidepressant action of MAOIs involves increasing the concentration of serotonin, norepinephrine, and dopamine in the neuronal synapse by inhibiting the MAO enzyme that degrades or breaks down these neurotransmitters. Again, allowing them to remain around longer to have their side effects. You have a table that contains your category antidepressants, the use, the side effects, caution, or contraindications, along with your interactions. Did you know that the SSRIs are considered to be the first line medication for the treatment of depression? They are preferred because of fewer side effects, greater safety in cases of overdose, and increased patient compliance. Here again you have a table. Make sure you read it and get very familiar with it. Our next antidepressant agent we are going to discuss is the second generation heterocyclic antidepressants are comparable in efficacy to the first generation tricyclic antidepressants, but have different effects on dopamine, norepinephrine, and serotonin, and distinctly different adverse effect profiles. take a moment and make sure that you get familiar with that category, the use, the side effects, cautions, or contraindications in the interactions. Very important. Okay, as we move on to anti-manic agents, bipolar disorder, sometimes known as manic depression, is a mental illness that is characterized by severe fluctuation in mood extremes. The cause of bipolar disorder is most likely an imbalance in brain chemicals that affect your mood. Again, we have a table that has the medication, the use, the side effects, caution, or contraindications, and interactions. Make sure that you review this table and get familiar with it, as well as review table 20-3.
Anxiolytic.
Anxiety is the body's natural response to real or perceived danger. This natural response becomes a disorder when it is excessive and difficult to control, and when it leads to significant distress and impairment. Types of disorder or types of anxiety disorders include social anxiety, post-traumatic stress disorder, which is known as PTSD, panic attacks, and obsessive compulsive behavior, which is like your OCD. These are your medications, your agent, your use, your side effects, contraindications, and interactions. Make sure to review and get familiar with those. As you are looking at the screen, what I have done is color-coded the medications along with its use, the side effects, the caution on contraindications, and the interactions to help differentiate the medications in that category. Let me know if you have any questions, but just make sure you read it, get familiar with it, and understand it. Antipsychotic agents. Antipsychotic medications are major tranquilizers assisting the treatment of relieving symptoms of psychosis, including delusion, hallucination, agitation, and combativeness associated with conditions like schizophrenia. These agents work primarily by blocking dopamine receptors, which accounts for their antiemetic effects, but results in unbalanced cholinergic activity, which causes frequent extrapyramidal side effects, which is considered EPS, including tardive dyskinesia, TD. So what does extrapyramidal mean? Make sure you understand what it means. And what does tardive dyskinesia? Make sure you know what those mean. Also, make sure to read your clinical connection on page 418 and patient education. We have to understand the patient education in order to educate our patients. All right. You also have the table that's in front of you, the antipsychotic agent, the use, the side effects, contraindications, interactions. Okay. Substance abuse is our next topic. Drug abuse can be defined as the use of a drug that is used other than therapeutic purposes. According to the American Addiction Centers, an estimated of 19.7 million individuals ages 12 and older in the United States battled substance use disorder in 2017. Drug addiction consists of the combination of all four of the following: tolerance, psychological dependence, physical dependence, and withdrawal syndrome with psychological effects. Chemistry dependency is the term used to describe a condition in which alcohol or drugs affect normal functioning and have taken control of an individual's life despite the problems related to their use. Knowledge check activity, which is not a contraindication to the antipsychotic drug haloperidol. Look at your choices, write down your answers, and we'll check them at the end of the video. Our next topic is alcohol. Alcohol can be classified as a psychotropic drug and a CNS depressant. It is a fast-acting depressant, and the body reacts to alcohol with excitement, sedation, and finally anesthesia. Large amounts of alcohol can result in alcoholic stupor, cerebral edema, and depressed respiration. Alcohol is rapidly absorbed from the GI tract into the bloodstream. Alcohol abuse is common and can cause many long-term health issues. So if you're looking at your screen, that is figure 20-5, and it gives you like some of the complications that can happen. Let me also mention this. Prolonged alcohol use affects most of all your organs, which you can see. Chronic drinking causes liver damage and pancreatitis. Alcohol irritates the mucosa of your digestive system, leading to gastritis, ulceration, and hemorrhage. Alcohol can also lead to malabsorption of nutrients and malnutrition. So we're going to get in with alcohol poisoning. Symptoms of acute alcohol poisoning includes cold, clammy skin, stupor, slow, noisy respiration, and alcoholic breath. For treatment of acute alcoholic poisoning, it usually is with close observation, meaning we're going to look at their respiratory problems, make sure that there's not any respiratory problems. We're going to look at their airway. We make sure to watch for any vomiting, because they can have aspirations. We look at seizures. We just make sure that it does not become what they call a status epilepticus, cerebral edema, and that can be treated with diuretics, electrolyte imbalance. Sometimes they can become dehydrated, so they may have to have IV fluids that contain thiamine, folic acid, magnesium sulfate, vitamins, and usually that is considered what they call a banana bag. And then sometimes people can have alcohol withdrawal syndromes and delirium tremens, and those are treated with IV benzodiazepines. Next up is our chronic alcoholism. Those symptoms include falling and accidents, blackouts and memory loss, dulled mental
Faculties.
irritability and neglect of personal appearance or responsibility. Treatment includes vitamin B1, and it can either be by IV, IM, or PO, or multiple vitamins and folic acid. Low carbohydrate and high protein diet to combat hypoglycemia. Elimination of caffeine, which in coffee, tea, chocolate, and soft drinks. Re-education of the patient with intensive individual group and family counseling, including Alcoholics Anonymous techniques, which is your AA. We're going to take a look just for a second into pharmacology, therapy, and the
Disulfiram.
Is used with patient cooperation as part of behavioral modification and the use of daily maintenance doses of naltrexone. Naltrexone is a long-acting opiate antagonist which acts by blocking the pleasurable sensations associated with alcohol and opiates, and therefore lessen the desire or craving to drink. Naltrexone reduces the frequency and risk of heavy drinking, but does not necessarily enhance abstinence. It is better tolerated than
Disulfiram.
but because it works to decrease the desire and rewards of drinking rather than elicit a punishment for consumption. Now, how do we educate our patients about this medication?
Disulfiram.
Make sure to read that. We have a knowledge check activity, which includes the treatment plan for chronic alcoholism. You're going to select all that apply. Write your answers down and we'll check them at the end of the video. Now we're going to talk about prescription drug abuse. What is prescription drugs? So prescription drug abuse is one of the most serious and fastest growing problems in the United States. Treatment of opiate addiction consists of a combination of counseling, behavioral therapy, and medications. Proper disposal and storage of prescription medication is important for deterring drug abuse. Keeping medications, especially those controlled by the Drug Enforcement Administration, which is your DEA, in a locked and secure place can help prevent theft of prescription medications. Disposal of controlled medications can be done in one of the four ways. Dispose it in the normal trash, but mixing with coffee grounds or pet litter to make them undesirable for consumption. Utilizing drop-off days at local government facilities or locating a drop box where they can safely be disposed of. Using a drug disposal system designed to inactivate drugs to make them unable to be assessed, and flushing controlled medications down the toilet. Although this method is not preferred, controlled medications can be flushed if no other options are available. Okay, so now we get into illegal drug abuse. There are 5 types of substance that can be produced illegally, and that is heroin, amphetamines, marijuana, cocaine, and hallucinogens. We get into heroin. What is heroin? Heroin is an opiate made from morphine. It can be white or brown powder, or it can be a black sticky substance as known as black tar heroin. Heroin affects the body in the same way as prescription opioids does. It enters the brain rapidly and binds to the opioid receptors, especially those that is involved feeling of pain and pleasure, and those involved in controlling heart rate and your breathing. Heroin is extremely addictive, and tolerance is achieved rapidly, meaning fast. So, meaning higher amounts are needed as each time you use it, you would need a little bit more. There are many negative side effects from using heroin, although the most dangerous types is the overdose. And how do they treat the overdose? Is what they consider a reversal agent, and that is called Narcan. Amphetamines is they can be produced and prescribed legally, and are also produced in illegal labs. Example of methamphetamine, which is known as crystal, crank, ice, meth, or speed. So those are the most commonly named. Amphetamines can cause emotional liability, irritability, anorexia, mental impairment, confusion, amnesia, and neurotoxicity. There is no specific antidote from amphetamine overdose. Treatment of an overdose is symptomatic and includes attention to airway, breathing, and circulation with administration of a sedative drug or drugs. Administration of activated charcoal may help if it can be administered within 1 to 2 hours after it has been ingested. Abrupt withdrawal of amphetamines may unmask mental problems. Therefore, patients require careful supervision during withdrawal, and long-term follow-up may be required because of some manifestations. Okay. Now we talk about marijuana. THC is an active ingredient in marijuana. Technically, it's classified as a CNS depressant. It possesses properties of euphoric, sedative, and hallucinating. When it's not regulated, its composition varies widely, and the methods of administration does not provide a standardized and reproducible dose. Dispensaries with licensed pharmacists are available for patients to get prescriptions filled. Side effects include short-term memory loss, impaired learning, slow intellectual performance. Other names in the hallucinant synthetic cannabinoid classification are known as spice, K2, skunk, and fake weed. These products are abused by smoking and contain dry plant material and chemical additives that are responsible for their hallucinogenic effects. Cocaine. Cocaine is also a CNS stimulant and produces euphoria and increased expenditure of energy. Cocaine is highly addictive, causing dependence even after short-term use. It is abused by intranasal application, which is like sniffing and snorting, intravenous injection, and inhalation. Severe depression can be associated with withdrawal, which is a lengthy and difficult process. Side effects include hypertension, chest pain, tachycardia, cardiac arrhythmia, stroke, and respiratory failure. Cocaine is also known to cause tremors and seizures. Next up is our hallucinogens. They are your lysergic acid and phencyclidine. It's like an animal tranquilizers. They produce bizarre mental reaction and distortions of physical senses. Your side effects include increased pulse and heart rate, your blood pressure and temperature, and rise in your blood pressure and temperature. And you can have possible physical injury to yourself or to others due to your psychotic episodes, panic, or paranoia. Your next up is your dextromethorphan, which is your DMX. It is a semi-synthetic morphine derivative. It is safe, effective, it's non-addictive, it's an over-the-counter, or OTC, which is over-the-counter, cough suppressant when used appropriately. Your DMX, primarily the one found in Robitussin and your HP products, is often abused because of its phencyclidine, like your euphoric effect in higher doses. The abuse of the DMX can cause serious effects, adverse effects such as brain damage, seizures, loss of consciousness, and you can have irregular heart rate and even death. Your flunitrazepam is a potent BTZ. It's not approved in the United States yet. It is used as a recreational drug, sometimes snorted to offset cocaine withdrawal, and is known on the street as roofies. It is also required the title date rape drug because of its ability to induce amnesia, preventing the victim from recalling specific events while under the influence of the drug. Knowledge check activity. Which illicit drug affects the body the same way prescription opioids do? Look at your choices and write down your answers, and we'll check it at the end of the video. Alrighty, we've got a case study. A 28-year-old patient is transported to the emergency room after being found in an alley, unconscious but still breathing. The physician orders a full lab work to determine the patient's condition and cause of unresponsiveness, decreased respiration, and slow-moving pupils. While waiting for stat labs to come back, they notice a white powder substance in his nose. The medical staff runs a quick test and determines it to be heroin. In an attempt to regain consciousness, the initial emergent treatment would be which of the following? Look at your choices, write down your answers, and let's check it at the end of the video. Now we're going to look at the role of the medical personnel in combating drug abuse. And it is understanding psychotropic drugs, their actions, and their side effects. Willingly participate in the education of the patient's family, and others in the community. Giving competence care to those under the influence of drugs, and don't be judgmental about it. Recognizing drug abuse and making appropriate referrals without any exception. Complete and accurate record keeping of any controlled stocks of drugs that would be considered potential drugs of abuse. Correctly documented. It is the responsibility of every medical personnel in your, no matter where you work, to recognize drug abuse and report any observed drug abuse to the proper person that's in authority. Looking the other way not only enables the individual to continue to harm themselves, but also endangers others around them. There are many services available to help medical personnel deal with drug abuse problems. On the screen, you will see resources, and they can help you get what you need. Check your knowledge activity, which is not a role that medical providers serve in combating drug abuse. Look at those choices and write those answers down, and we're going to check it at the end of this video. Self-assessment. This is some of the questions that you should ask yourself. What are the psychotropic classifications discussed in this chapter? What complications does alcoholism cause to the body? What are the roles of medical personnel in combating drug abuse? Alright, so you are now looking at knowledge. Check your activities, answers. Check your answers and see how much you retain while listening to this video. If you have any questions, make sure to ask your instructor. And I hope you enjoyed it. Thank you.